my heroes are really the patients that come every day to MD Anderson Cancer Center. And my father-in-law was a patient here for 20 years. He was a lymphoma survivor. And he was one of the first patients to receive a new medicine called Rituxan, which is used for a lot of different blood cancers now. And he was diagnosed when he was about 50 years old, so he wasn't terribly old when he learned that he had lymphoma. And he was told that he had 3 to 5 years left in his life. And he was not willing to accept that sentence. So he traveled around the country trying to find the doctors and researchers who were doing some of the most cutting-edge clinical research, and he enrolled himself on several clinical trials. And he received a lot of intensive therapy. And some of the medicines that he received actually caused complications for him later in life because nobody expected him to live for as long as he did. But interestingly, some of the complications that he had from his medicines are some of the same complications that pediatric patients suffer because they live for a long time after they're diagnosed. So that's another part of my job, is to find medicines that are not going to do damage that will cause complications later in life. And that's extremely important in pediatric patients because 85% of pediatric cancer patients survive their disease and they have the rest of their lives to look forward to. And we want to make sure that they have rich lives that are disease-free and they can enjoy the remaining part of their lives just as anyone else would.